Hello, my name is Angela. I'm your nurse today. I'm going to just be teaching you a little bit about how to recognize your different blood pressure ranges when you're at home and when to contact your doctor should your blood pressure get too high. All right. First, I'm going to teach you the normal blood pressure ranges, and I've used this printout from the website www.heart.org, which is the American Heart Association. They have a lot of information on there for you to go and look at regarding your blood pressure. So if you look at this pamphlet here, you have a normal blood pressure that is less than 120 systolic, and systolic is the top number. Diastolic is less than 80, which would be the bottom number. Elevated blood pressure is when your blood pressure is 120 to 129 for the top number, and for the bottom number, less than 80. High blood pressure would be 130 to 139 for the top number, or 80 to 89 for the bottom number, or the diastolic number. In high blood pressure, we consider high blood pressure anything over 140 for the top number, or over 90 for the bottom number, the diastolic. And like I mentioned before, knowing when you should go see the doctor, that would be considered a hypertensive crisis. A hypertensive crisis, you need to consult your doctor immediately, and that is for any blood pressure that is higher than 180 for the systolic and more than 120 for the diastolic. That does not mean that it needs to be both. It can be either one. The top number above 180 or the bottom number above 120. You would need to contact your doctor right away so they can get you in and get you some medication to lower your blood pressure. All right, and how we're going to evaluate this, I'm just going to ask you some questions to see if you remember what the blood pressure ranges are. So what would your blood pressure need to be above before you go see the doctor? Yes, 180 for systolic and 120 for diastolic. Good. All right, and what is a normal blood pressure where you would want your blood pressure to be when you are at home? Right, less than 120 and less than 80. Good. It can be elevated. That's not bad for some people. Sometimes the doctor orders that for you to have you just a little bit higher because that is your average in the range 120 to 129 and less than 80. Okay. And what is high blood pressure? Right. Anything over 140 systolic and 90 diastolic. Good. All right. It looks like this education has been successful. You know your ranges for the different blood pressure levels, and you know when to contact your doctor. I'm just going to leave this with you to take home, and it also has the website on the bottom, so you can go to that if you have any other questions, or if you forget, or if you check it and you're not sure which level it is in, this can remind you of that. Okay, thank you. Bye.